Dr. Pallavi, IVF Specialist at Nova Fertility Center, Tamram. In this video, I am going to talk about process of embryo transfer. Usually, embryo transfer usually we will freeze all good quality embryos in the same. Usually, embryo transfer. Some people we will transfer embryo after egg collection, third day of egg collection or fifth day of egg collection. If all like a lining is very good, good quality of embryos we got, that estradiol they are not going with they are not develop hyperstimulation syndrome. Hyperstimulation syndrome means if they get more number of eggs, then estradiol level is very high. In that particular conditions, we cannot transfer embryo immediately after egg collection or day 3 or day 5 after egg collection. In that particular conditions, what we can do, after forming of embryos, we will freeze it, and next cycle we will call the patient. Once they will come on day 2, usually we will see scan, and in scan there are no cyst and endometrium is very thin, and we will advise some hormonal test. Hormonal test all are within normal limits. We will give some medicines. Medicines means estradiol tablets. Usually we will give those tablets. Estradiol tablets we will give for 6 to 8 days, and then we will ask them to come and we will see the scan, and we will assess the thickness of lining of womb. If it is at least it should be 9 to 10 mm with a good flow. Good flow also better to measure by scan. If it is a good flow and the thickness is very good, then we will start some progesterone tablets. Vaginally, we can advise vaginal tablets or vaginal gels or oral tablets. Injections also we can advise. So, depending on the day of embryos transferring, like day 5 embryos, whether we are transferring day 5 embryos or day 3 embryos, depending on that, we will give progesterones for 3 days or 5 days. Usually in our center, usually we will transfer day 5 because of day 5 embryo transfer gives good success. So, usually we will give 5 days progesterones, and then 6th day we will transfer the embryo. We will give advice to the patient, don't stop any medication till the day of embryo transfer. It is there is no need of sedation for this embryo transfer. It is like IUI only, but we can do in embryology lab, where usually in theater where sterile environment will be there, and embryology lab very near to that particular procedure room, there only we can do embryo transfer. So usually under ultrasound guidance we will transfer the embryo. So they should be they should come with a partially filled bladder to make the uterus in a correct position. So one person will guide how we are transferring the embryo. Usually embryologist, they will take the embryo into the cannula, and they will load it into the cannula and they will give it to the physician. We will take that cannula and transfer inside the womb under ultrasound guidance. Once we will transfer embryo, we will document that, and we will show the process, live process to the patient in the scan, and usually that embryo that ID number, name of the patient, everything will be written over that particular embryo straw, that we will show to the patient, then confirm with the patient, and then only we will transfer the embryo into the womb. So once we will transfer the embryo, we will ask them to stay for 15 to 20 minutes. And then usually maximum half an hour they can stay at our center, and then we can send them back to home. Actually, there is no need of giving strict bed rest, and we will give some progesterone supplementations and medicines to support the pregnancy. We will advise those medicines for 14 to 16 days, and after 14 to 16 days we will ask them to do serum beta HCG value to confirm the pregnancy. This is the procedure of embryo transfer and confirmation of pregnancy after the embryo transfer. Thank you very much.